Hi everyone. Hope everyone can hear me okay. Welcome to this evening's virtual event. It's nice to have everyone along. I think we've got most people here. So we're going to have a presentation, first of all, that's going to go through the ins and outs of a treatment cycle with care. There's going to be a couple of videos and we're going to have a Q&A session as well. So we've received some of your questions beforehand, but you are welcome to add any of your questions into the chat function. So you can, if you put things into the chat function, then everyone can see it. But there's also a messages area where you can put messages that won't be seen. So we've also got a team on standby behind the scenes that we've just got a message on there. They're here till 8 o'clock this evening. There's the number, 0800 564 2270. And you can get in touch with them at any point up until 8 o'clock tonight, or anytime tomorrow, or anytime whenever you like. And you can also email us if you wanted some more information at events@carefertility.com. So if we don't manage to answer all of your questions, then we'll endeavour to answer them via email. So let's get started then. So we're going to have a video just to set the scene a bit first of all. So I'm just going to share that with you all now.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualised treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay, so we're going to go into the presentation now. So hopefully you can all see that. 1 in 6 people need help starting a family, and Care really do believe that family is for everyone. So we have clinics all over the UK. We've got one over in Ireland as well. And we think that this gives patients the opportunity to reach a care clinic as easily as possible wherever you might be. So we have our main clinics, which you can see in turquoise and purple. And then we've got a few little smaller clinics dotted around that are what we call our satellite centres, where you can have lots of the initial investigations and meet a consultant, and then you can have your main treatment in one of the larger centres. So we treat all different types of patients. So not only do we want to make it geographically easy in terms of family is for everyone, but we believe that every person deserves the chance to have a family. So we treat heterosexual couples, same-sex couples, single patients, and those needing to use donor sperm or eggs, perhaps. So during the course of this presentation, I'm going to refer to the standard IVF pathway. So depends on your situation, you might have a very specific treatment that you need to undertake, and it would be really difficult for me to go into all of those in any great detail today. But generally, the process of IVF will be very similar for each of you. So first of all, getting started with care, it's really, really easy. So this is Shah, our General Inquiries team manager. All you need to do is get in touch with us and get the ball rolling. So you get in touch with our GEM team, and they're a really knowledgeable team. They know loads about care, obviously, and they know loads about the treatment that you need to have. And they can give you a bit of basic information about where to start. So as I said, they're available tonight until 8 o'clock if you wanted to ask any specific questions. And Lauren Barker, you can see her writing on there. She's our new patient inquiry team leader, and she's part of the events team tonight. So really knowledgeable team behind the scenes to answer all of your questions. So the first step, obviously, once you've got the ball rolling with getting started with care, is we want to make sure that we've got the right diagnosis for you. So this is really important. We obviously want to make sure that you're going to get the right treatment for the diagnosis that you might have. So we want to take the time to get to know everything about you. And we'll ask you to provide us with information that you might have had from previous treatments or from previous investigations. And we'll ask you to provide this information to us via our secure online portal. So this is a two-way portal where we can give information to you and you can give information to us. So you can get it on a desktop, computer, laptop, mobile or tablet. It's really easy to use, and we'll send you quite a lot of information on there at different points in your journey. So to start off with, we'll send you a detailed medical questionnaire, and you'll fill that in via your online portal. And that will really set the scene for our consultants to know which treatment path you should go down. And then we'll, as I said, we'll ask you to upload any previous medical records that might be of use. And we obviously don't want to do any repetition of tests if we don't need to. So if you've had a semen analysis recently, or if you've had blood tests recently, we'll ask you to upload all of that information to your portal so that we don't ask you to go through the same thing again. So all of that information is received by a consultant. So this is George from our Sheffield clinic. And in this consultation, the consultant will take all the time that you need. to get to know everything and really come up with a detailed treatment plan for you. So we're going to listen to your plans, your wishes, how big you want your family and what your aims are in terms of timescales. We're going to review all of your test results to make sure that everything is there that's required. Do we need to repeat anything? And we're going to explain why we might need to repeat certain tests, why the tests that you might have done already might not be appropriate and we might need to repeat them. We're going to talk to you about the different treatment options that are available to you and what would be suitable for your specific situation, and then discuss the chances of success. Obviously, that's going to vary depending on your circumstance. So we'll give you detailed information about all of the treatment options. We'll upload all of that up into your portal so that you've got time to review it and decide how you want to proceed. And we'll talk to you about costs and let you know what support is available during your treatment as well. We're going to give you all the time that you need to ask all of your questions at this consultation, obviously within reason. It's really useful for you to come along with some questions that you might already have, just in case they aren't answered for you in that consultation. You can ask the doctor there and then. So whether the problem is simple or complex, we've got a breadth of knowledge across the care group in terms of our consultants, really highly qualified, highly experienced consultants throughout the UK that can help you create your family. So as I said, everyone is different and there will be an individualised treatment plan for every single patient depending on your circumstance, but I'm going to go through the basic IVF process so that everyone's got a bit of an idea. So you might not need something as interventional as IVF. You might decide that you wanted to do something like an IUI instead, which is intrauterine insemination. I'm not going to cover that here, but that would obviously be discussed with you if it's an appropriate option for your circumstance. So the first step in the treatment process is the ovarian stimulation. So what we aim to do is to give you a dose of drugs, ovarian stimulation drugs, that is based on your personal circumstance, so your blood results, your age, and the consultant will talk you through what dose they think is appropriate for you. We'll provide all of this medication for you, and you'll take it for anywhere between kind of 9 and 13 days. Could be more, could be less. But what we're aiming to do there is stimulate the ovaries so that we get multiple follicles developing, each of which should contain an egg. So you'll get a medication protocol that will be uploaded to your portal, and it will be explained to you in detail so that you know exactly when to take your drugs, at what time. There are quite a few different ones to be taken at different times, so it's important that that protocol makes sense to you. We've then got an online injection teach, which will basically teach you how to perform these injections. It's one of the things that patients can be a little bit apprehensive about, but we've got videos online that you can go back to and rewatch as much as you need to help you through that injection process. So we're then going to monitor the ovaries to make sure that they're responding as we'd hope. So we're looking, using ultrasound, we're looking for a number of follicles to have developed from the stimulation. And once we've got a good number of follicles at a certain size, we're then going to give you a final injection that's called the trigger injection. And this is the final injection that you would take to mature the eggs and make sure that they were ready for egg collection. And then the egg collection would be 36 hours after you've taken that final injection. So the egg collection is straightforward. It's should be a very straightforward procedure. You shouldn't need a lot of recovery time afterwards. An ultrasound probe guides the needle directly to the ovaries to carefully remove the eggs from the ovaries. So you can see on the screen here, we've got some ultrasound images, and there's some black areas, and that's the that's the fluid that's within the follicles. So we'll pass the needle into those follicles and drain the fluid, and that fluid will be passed through to the lab team to find hopefully an egg. So it should be around 30 minutes. Sometimes it can be less, sometimes it could be more. It's dependent on the number of follicles, obviously, that have developed. And it'll obviously be followed by a short rest with us, just to make sure that you've recovered okay, and then you'll be free to go home. So we've collected the eggs, and we obviously then need the other part. So we need the sperm. So the sample is usually given at the same time as the egg collection. That's if you're using a fresh sample. If the sample is frozen, for example, it's been frozen previously, or you might be using frozen donor sperm, then it will be thawed on the same day as the egg collection. At the minute, because of COVID, we're operating a drop-off service as much as possible. So as long as you live relatively close to the unit, kind of within 60 minutes, then we would ask you to produce the sample at home and then bring it with you when you come in for your partner's egg collection. So we've got a short video about a sperm sample. So it's a new way of analysing sperm. So ordinarily we would look down a microscope, and a human would just have a look at how the sperm was swimming and just check that they were all going in the right direction and they all look normal. But on this video you can see that we've got some AI tracking the sperm across the screen. And also on the far right, showing us which sperm have got abnormal morphology. And this technology helps us to determine sperm parameters really well, really accurately, and reproducible. So along the top, we get all of the information about the sperm sample, and that tells us how many sperm there are, which is the concentration, how well they're moving, which is the motility, and then what they look like, which is the morphology. Okay, so we've got the eggs and we've got the sperm, and then we need to put them together and create the embryos. So there's two ways that we could achieve fertilization. The first one is IVF, and the second one is something called ICSI, which is intracytoplasmic sperm injection. So with IVF, we need to have a good number of normal moving sperm, and we would place the sperm in the dish with the eggs and leave them overnight. So we'd usually place around 200,000 sperm in the dish with the eggs. And then we check them the next day for fertilization and obviously monitor embryo growth. With ICSI, the ICSI is usually performed for patients with a low concentration or a low sperm motility. So the sperm aren't moving very well, or there's not very many of them. And what we can do is physically inject a single sperm into each one of the mature eggs. So these will be explained to you in more detail. You get plenty of information, and obviously it will all be dependent on the semen analysis, which you'll have before the treatment commences. So once we've put the two together, the eggs and sperm together, we'll then check for fertilization the following day. So the following day after your egg collection, we must perform the insemination or the injection on the same day as the eggs were retrieved. And then 16 to 18 hours later, we'll have a look at the eggs and see if they've fertilized or not. So I've just got a video of the ICSI procedure to show you. So you'll see the egg in the middle, that's being held in place, and then the sperm on the right-hand side coming down the needle. The needle is pushed gently inside the egg, and we suck up a little bit of the cytoplasm of the egg to make sure that the membrane is broken, deposit the sperm in the middle, remove that needle really carefully, and then that's the ICSI process done for that egg. So we would need to perform that on every single mature egg that you had. Not all of the eggs will be mature. The the likelihood is that around 80% of them would be. Sometimes it's more, sometimes it's less. It just depends on your situation. So once we know what's fertilised, we then monitor their growth over the course of 5 or 6 days. So this is Alex, our London lab manager, and she's looking at some embryos on our time-lapse incubator, which is Care Maps. So the images in the bottom right-hand corner, you can see 4 images, and the top left one is a fertilised egg. It's got 2 circles in the middle, and that indicates to us that there's DNA from the egg and the DNA from the sperm have come together. The next image along the top right, that's a 4-cell embryo. That's where it would be around day 2. The bottom left is an 8-cell embryo. That's where it would be around day 3. And then the bottom right image is a blastocyst. And at that point, it's got over 100 cells. We can't count them anymore, but we can grade the embryo at this stage and pick the best one. So we've got lots of different technologies that are available for your treatment, and the consultant would talk to you about the ones that are most relevant for you, for your situation. But there's 2 that are that we're particularly proud of and interested in. So the first one is Care Maps, and I mentioned that before. This is a piece of technology that monitors the embryos, takes a picture of them every 10 minutes, and we end up with a video of the embryo development all the way from fertilization right up until the point where we use the embryo, either transfer or freeze it. So this information is way beyond what we've ever had before, and we've developed some really good tools to select the best embryo out of a group. So within the software, there's the facility to score the embryos from 1 to 10. And that gives us a chance of a live birth based on that score. So we're able to tell you if an embryo scores an 8, for example, this is your percentage chance of a live birth. So Care Maps is something that we're really proud of, and we obviously can provide as much information about that to you as you want. The other one is PGTA. So on the right-hand side, you can see an image of a blastocyst and some of the cells just sitting in a needle. This is where PGTA is where we would remove around 5 to 8 cells from a developing embryo. Remember, at the blastocyst stage, they've got about 100 cells. So we're taking a portion of the embryo away, and we send that off for genetic testing. And that tells us whether the embryo is likely to be genetically normal or not in terms of number of chromosomes. So PGTA is really useful for certain patient groups. And again, we would talk to you about that, whether we think it's relevant for you. There's lots of other tests and technologies that we have. So things like Care Unity, the SOS test. We've got genetic and health tests, and obviously we perform fertility preservation as well, which is oocyte vitrification, which is a newish technology. So all clinics regularly or consistently achieve really good success rates, and the success rates for the individual clinics are available. They can be found on websites, and you can also ask our events team as well. If you've got a clinic near you and you want to have a look at success rates, then you can ask for some more information on that as well. So just got a video of the Care Map system, just so that you can see an embryo developing and what kind of thing we get to see. So this is started at around day 3 and it's developing into a blastocyst. So it's around day 4 now. And then a cavity starts to form in the middle, and the cells start to spread out. The embryo starts to grow, and we start to see a massive forming around 3 o'clock it is now. And that's the bit that becomes the baby. So that's how we grade an embryo when it gets to that stage. We can see that massive cells forming, and we can see that it's created a nice healthy mass, and that's a really good indicator. So back to the presentation. So once we've decided which embryo is the best out of the group, we either have used care maps or PGTA, and we've determined which embryo out of the bunch is the best. It's obviously the time for the embryo transfer. So this is a really straightforward procedure, much more straightforward than the egg collection. So you're awake for this. It's very like a smear test. They're done under ultrasound so that we can see that the embryo is going back in exactly the right place. The embryo or embryos would be loaded into a really soft, fine catheter, and that would then be passed through the vagina, through the cervix into the uterus, and the embryos would be deposited. So it's a 15-minute procedure. As I say, really straightforward, and you can go about your normal activities as soon as the transfer is finished. And then it's the 2-week wait. So we would need you to perform a pregnancy test, but we need you to perform a specific day, and this is usually around 2 weeks following the embryo transfer. So once you've taken the test, we'd ask you to get in touch with us either way. If it's positive, great. We'll book you in for a scan appointment in kind of 3 to 4 weeks' time after that, to test whether there's a heartbeat. If it's negative, obviously, we can offer support as much as you need and talk to you about any next steps that you wanted to take. Once you've had the scan, if it was positive and you've had the scan and there's a heartbeat, we then discharge you to your GP for standard antenatal care. So onto some more specific things about care rather than the treatment itself. So donation, we've got a huge donation team. We're really big on donation and care. We've got 25 years worth of experience with donation. So we do lots of treatments involving donated eggs and donated sperm. We have our own banks, so we have our own care egg bank and our own care sperm bank. So if you needed to use donor eggs or donor sperm, we can help you with that as much as you need, and we'll support you through the entire process. So we have specialist counselling for this kind of treatment to make sure that you understand all of the implications involved. So there's loads of support available at Care. We've got lots of things on the go. We do free counselling appointments so that you can have counselling at any point in your treatment, at the beginning, in the middle, at the end, 6 years later. We run the Care Buddy system, so you can be buddied up with someone who's also going through fertility treatment at around the same kind of stage, and you can talk to each other and help each other through. We do loads of support events, regular online support events. We obviously did a lot more in-person meetups before COVID. Hopefully we're going to be able to start those back up again really soon. And there's a 24/7 care forum as well. So you can chat to all of the patients that are on there, and it's specific to care. So it's for care patients only. And as always, the clinic that you're having treatment with will support you every step of the way. So all you have to do is just get in touch with your clinic and ask for the support that you need. The other thing that we're really happy about, something called Care Pay. So this is an exclusive IVF funding program to make the funding of your treatment easier to manage. It's individually tailored, and obviously it's designed to give you the peace of mind of knowing that a plan's in place to fund the treatment that you want to have. We created Care Pay following feedback that it was disruptive for patients to have to go outside of care for funding programs. So we basically brought it in-house, and we've got a dedicated team, really knowledgeable and really able to help you set up a program of funding that works for you. All of the Care Pay packages include the cycle monitoring, the egg collection, all of the embryology procedures, embryo transfer, freezing and storage of embryos, unlimited embryo transfers, and the blastocyst culture and care maps as an extra benefit, obviously to give you the best chance of success. Okay, so that's everything in terms of the presentation. That's the number there again for you, just in case you missed it. Ask as many questions as you want. I can see the chat is going crazy, so that's good. So we're going to have a Q&A now, and hopefully Professor Kingsland is going to join us. He was already. I think this is him.
Here I am.
Hello.
I did it all by myself.
Well done.
Thank you.
Very good.
Thank you. How are you, Amy?
Yeah, I'm fine, thank you. And how are you?
Good, thanks. Good. Loads of questions.
Yeah. So have you got a list there? Do you want to kick off?
Yeah, do you want me to kick off and then we'll share them out depending on what there's a lot of questions here. We can't be specific, but I'll make sort of generalizations and hopefully it will be of benefit to most of you. But as you say, we've got a lot of emails and questions going on just here now. We'll try and get back to everybody, and if we can't answer your questions, then we'll do them by email. So if a patient had blood tests, scans, a semen analysis done within the last 6 to 12 months, do they have to be done again? Well, the answer to that is no. It depends on where they were done. They obviously need to be done at a reputable clinic with an accredited laboratory. And if your history hasn't changed, then you haven't sort of gained weight or started smoking 60 cigarettes a day or something like that, then usually within the last 6 or 12 months, those tests will suffice. Don't go doing additional tests that may be expensive if you don't need them. So just stick with those, and then your local clinic will give you advice. Medical review stipulations: do certain levels of AMH restrict where you go? AMH is the hormone that's secreted by your eggs. The more AMH you've got, the more eggs you've got. There are lots of AMH doesn't reflect on the quality of your eggs, it reflects on the quantity. So there are lots of other things you've got to take into account: your age, your weight, whether you've had previous tests. But generally speaking, in a self-funded clinic, AMH doesn't matter because there's treatment for everyone, irrespective of your AMH. NHS clinics can be quite restrictive. There are some clinics, certainly in the northwest of England, that will say your AMH needs to be over 5 to qualify for NHS treatment. That doesn't mean to say that your prognosis is necessarily your outlook is necessarily lower, but you need to check with your local NHS providers to see what their criteria are. For care pay, sometimes that's our payment scheme that's unique to us, the care family. Care pay, it says unlimited frozen embryo transfers. Well, let me see if I can get this right, Amy. You can correct me if I'm wrong. But basically what we try and do at Care is we create embryos, as many as we safely can. We will maybe put back a fresh or embryo if that's appropriate for you, but we try and create a bank of frozen embryos, and that's usually after one single egg collection. So if we have a bank of embryos, and it may be you have 5 or 6, we've got some patients in Liverpool that may have over 10 embryos that are frozen in their bank. If you're in care pay, every single one of those embryos that are replaced will be within the care pay package until you get a live baby. Once you have a live baby, then I think the care pay program finishes, and then any subsequent embryo, if you want to add or expand your family, will be out with the care pay package, and you will need to pay separately.
Yeah, but we'd say ring up the care pay team or our inquiries team to get some more information about that.
Yeah, I would say that I'm not, as a doctor, I don't understand care pay, but what I do know is that for a lot of people, it can be very beneficial, financially advantageous. And when you're choosing a clinic, it's important that when you are, budgeting for clinics, you get the exact prices so that you know before you start what this means. You know, there'll be many clinics that will be saying that this you know, buy one get one free, or this one you only pay, you know, 50 quid. That doesn't happen. There will be, most IVF cycles will cost around about the same, irrespective of where you go. Some areas, maybe London, may be a little bit different, but you need to know exactly how much it costs before you start. And CarePay can be a very useful way to budget for your IVF program.
Yeah.
Impact of TSH. Do high normal rate affect fertility? TSH is thyroid stimulating hormone. It's a hormone that's secreted by your pituitary gland, which is up here, that drives your thyroid gland to release thyroxine, which is a hormone that regulates your body metabolic rate. The thyroid TSH gland is very close to your FSH, which stimulates your ovaries. So there's a close relationship. So we want, when you start your treatment, we want your thyroid gland to be as tightly controlled and as close to normal function as possible. So in some cases, not every case, it might be useful to check your TSH level. And there's a range by which we know can affect your prognosis. And thyroid stimulating hormone, if it's normal, it's fine. If it's high normal, it's fine. If it's high, it might not be fine. So from what you've told me, a high normal is okay. There was a lot of research done in the recent past about thyroid stimulating hormone and outcomes of pregnancy, but generally, if it's normal, it's normal. Okay, and that's good. How do we get back to care for another embryo transfer after a live birth? Well, you use the old tried method. Yeah, pick up the phone and phone us, or you email us. And if you've been to care and had a care baby, then you will have a portal where all your information is shared. So just get on the portal and say, we've had our baby, we've completed our breastfeeding, we'd like one of our next embryos back to help us expand our family, provided you still have embryos. And so that's what you do. Why are ectopic pregnancies more common in IVF and the ways to prevent them? Well, they're not. You know, when an embryo, it can swim around for a couple of days, and sometimes it can get stuck in the fallopian tube. However, what you have to remember that everybody is different, and patients who are coming for IVF may have a problem with their fertility due to damage to their fallopian tubes, or it may be that they have had a previous problem or some fluid in their fallopian tubes, which may restrict the embryo swimming around, and the embryo may get stuck in your fallopian tube. And that means that and it might not be able to get out, and so it decides to grow in there, creating an ectopic pregnancy. So there are some risk factors that can increase your risk, but IVF per se, as a technique, does not increase your risk of an ectopic. It's who you are, whether you've had previous damage to your fallopian tubes, or you've had a previous ectopic, or you've had tubal surgery, because they can increase your risk. It's a bit like saying IVF gives you abnormal babies. No, it doesn't. There is an increased risk in abnormal babies, a very small risk, but that's due to age of the patient. So people who have IVF, for example, tend to be a little bit older. The average age is probably about 36 compared with 32-year-old women who get pregnant naturally. When you're 36, your risk of getting an abnormal baby is higher. And if you have IVF and you're 36, therefore your risk is higher. It's not because of the IVF, it's because of who you are. But when you have these questions about ectopics and abnormal babies, you need the proper advice from your local IVF clinic, and let's hope it's a care IVF clinic.
Just on that, Charles, is there any way to prevent ectopics? Is there any?
Well, there are. So if you've had an ectopic pregnancy before, then your risk of having another ectopic pregnancy is higher. And let me tell you, I've never suffered from an ectopic pregnancy, but I've treated many, many hundreds, and it's not pleasant. It really is not pleasant. So if you want to prevent them, then there are ways of preventing. You can clip the fallopian tubes, so that actually prevents the embryo getting stuck in your fallopian tube, or you can remove the fallopian tubes. Now, what you have to bear in mind, that if you remove or clip the fallopian tubes, then that reduces your risk of ectopic, but it also reduces your chance of, well, it negates your chance of ever having a natural pregnancy, because you're effectively sterile. So you have to bear that in mind, weighing up the pros and the cons. But the thing about it is, if you've had a previous ectopic or you're at risk of an ectopic, your fertility doctor will recognize that, and there are ways that we can monitor for an ectopic pregnancy very, very early, so it doesn't happen again, and we can prevent it happening. How long after a failed embryo transfer can you have another? Well, I would say the following month. What would you say, Amy?
Yeah, generally.
No reason. If you've had a failed frozen embryo transfer and you desperately want another one, go the next month if you feel up to it. But that's fine. Can I have fertility assessment at my care satellite? Of course you can. That's the reason we're here. And just because you may not be trying for a baby, or you may have been trying for 3 or 4 months, you don't have to wait. If you feel anxious, and I've said this before, if you feel that you may have had something in the past that may lead you to think that you may have a fertility problem at the time when you want to have a baby, pop down to your clinic and say, look, this is what I'm concerned about. I just need reassurance. And to a large extent, we can provide that for you. We can never be 100% certain, but we can give you the reassurance that your AMH is normal, your ultrasound is normal, the sperm count is normal. So, crack on. But if you've got a worry, share it, because that's what we do. What can cause genetically abnormal embryos, Dr. Barrie?
Well, lots of things, and probably too many to talk about. But probably the biggest risk factor for genetically abnormal embryos is female age. So if you're over the age of kind of 38, then your chance of having genetically abnormal embryos is higher. So you would fall into a patient group where we might be recommending something like PGTA, where we can test for normality. But generally, it's a natural occurrence, and it just happens in a number of embryos across humans. So in any given population, the rate of embryos can be between 50 and 80%, and it can vary depending on age.
Great. What makes care maps better than monitoring at other clinics? Well, I'm a gynecologist, so I rely heavily on my scientific colleagues to tell me when the quality and the grade of the embryos and the likelihood that they will turn into babies. And care maps is a system of a closed incubation system where the embryos are grown in a nice warm environment, free from interference. They're videoed and monitored, and the growth and development of the embryos are monitored every 10 minutes, and all the measurements are then put into an algorithm which the embryologists interpret and give an account as to the grade of the embryos. And for me to see those embryos growing and dividing, it brings the laboratory into the clinic. So not only can I see how the embryos are growing on my USB stick, the patient can see what's happened, how they're growing, and which ones are likely to turn into babies. And isn't it great that when you do have your baby, you can have an actual record of that embryo growing from 2 cells?
Yeah, if not earlier.
If not earlier.
I think there's 2 main things about the care maps. Is the first one is the undisturbed nature. So in any of the lab that doesn't have care maps, you would have to remove the dish from that controlled environment, which we cannot replicate in the outside environment. We have to replicate a human body inside an incubator. So to look at the embryos when they're not in care maps, we have to take them out of that environment and expose them to suboptimal temperatures and gas levels. And then the second thing is the amount of information that we get from the embryo development, and that ability, as Charles said, about the algorithm, to plug all of that information in and get a score about the embryo development we wouldn't have if they weren't in care maps.
Yep. Right. Some quick fire questions. What would be the next step after no genetically normal embryos after they've been biopsied? Well, first of all, it's not the end of the road. There are lots of reasons why they can be abnormal. See your IVF clinic to see what's happened, why it's happened, and is there anything we can do to reduce the chance? Because as Amy said, in normality, a lot of embryos are genetically abnormal. Just because this time you've had 100% abnormal doesn't mean to say the next time you might not. So everybody's circumstances are different. So 4 questions in 10 seconds. My husband has 3% morphology. That means only 3% of the embryos of his sperm is normal, which is a little bit lower because actually 96% of sperm is abnormal. Could this be a reason for my 9 miscarriages? Possibly. Go and see your gynecologist and get some expert advice at the fertility clinic. 35 years old, 4 years of unexplained infertility, all tested nothing abnormal detected. Would you go straight for IVF? Yes. Can high levels of prolactin impact on IVF treatment? Yes. I have hypopituitarism, so no periods for 16 years. Do you have any experience with this? Yes, loads. That's what we do. So don't worry. Come and see somebody and we'll give you the advice you need. Hypopituitarism usually does very well.
Yeah. Out of interest, the high levels of prolactin, what does that mean? How does that impact IVF? Prolactin
is a hormone that's secreted by the brain, which causes the release of breast milk. So it's the hormone that causes breast milk release. So it's raised when you've had a baby and you're breastfeeding. But one thing you notice when you're breastfeeding, you don't have periods, you don't ovulate. So breastfeeding is actually one of the world's best contraceptions. Not only is it brilliant for babies, but it's brilliant to prevent you having another baby when you're looking after that one. But sometimes high levels of prolactin can be raised when you're not breastfeeding. It can be a small benign tumor. They're always benign. They're never malignant that secretes too much prolactin. Drugs can do it. Stress can do it, but you've got to be really stressed. And what else? Just idiopathic. That means there's no reason. But it does mean that your fertility is lower than it could be if your prolactin is normal. So it's important to find out if you've got high prolactin, why you've got high prolactin, and reduce that level of prolactin to increase your fertility. So we need to know that. But generally speaking, if you've got regular periods, your prolactin is normal.
Yeah. Great. Fab. Well, I think that's it for Q&A. I don't think we've had any more. I think we've covered everything.
Can I go for my tea?
You can. You can go for your tea. You are released.
Okay, bye everybody.
See you later. Bye.
Good luck to you. Bye.
Okay, so we're just going to finish off with a couple of videos. So I'm just going to share the first one.
I'm Shah and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about care pay. our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success and treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
Okay, so that brings it to a close. Thank you very much for joining us. I hope it's been informative, and I hope you know where to go for next steps. Get in touch with us on the phone or via email. I'm sorry if we weren't able to answer all of your questions. We will answer them via email after the event, or in the next day or two. Thank you very much, and I'm just going to leave you with a few words from Care.
One in 6 people need help to grow their family. You're not alone. And our care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today. And behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.